Hello, hello. Welcome to Following Science, the podcast where curiosity meets discovery. I'm Rutu Ruparel, your guide on this journey through the fascinating world of science. Today, I have an exciting journey planned for all of y'all as we explore through time and explore some of the most notable pandemics in history, the strategies used to combat them, and of course, the lessons we learned to prepare for the future. Let's dive right in. Our first segment takes us on a historical journey through some of the most significant pandemics that have shaped our world. Let's start with a trip back to the 14th century. Now, imagine Europe in the 14th century. Life is bustling in medieval towns, but suddenly, a mysterious and deadly disease strikes the Black Death. This bubonic plague wiped out nearly a third of Europe's population. I want you guys to imagine the sheer impact. Entire towns were deserted, fields were left unplowed, and there was a massive shift in the demographics of this place. The mortality rates from the Black Death were staggering, and it led to profound demographic or population changes. But the Black Death also brought about significant advances in medical science and public health. It led to the establishment of early forms of quarantine and the recognition of the need for public health measures. Now, let's fast forward a few centuries to the Spanish flu. When World War I ends, the Spanish flu emerges. This pandemic infected about a third of the global population and resulted in millions of deaths. It hit hard and fast, spreading rapidly due to the movement of troops and poor living conditions. What we ended up learning from the Spanish flu is the importance of public health responses and the need for accurate information to prevent panic. The economic and social disruptions were immense, but so were the lessons learned. Now let's move on to the 1980s, the era of neon colors and big hair. The era where HIV and AIDS epidemic began to spread globally. Unlike the swift and deadly nature of the Black Death and Spanish flu, HIV/AIDS became a chronic pandemic, changing how we approach long-term infectious diseases. Now, the impact on society was profound, and it affected millions of lives and led to significant social stigma and discrimination. However, it also spurred advances in medical research, treatments, and caused us to get a more deeper understanding of viral infections. Now let's fast forward to the 21st century, where we encounter SARS in 2003 and H1N1 in 2009. These outbreaks reminded us of the ever-present threat of new infectious diseases. SARS had a high mortality rate, but was contained relatively quickly due to effective public health measures. H1N1, on the other hand, spread rapidly, but also they had a very low mortality rate. These pandemics highlighted the importance of preparedness and the role of international cooperation in managing public health crises. And now, finally, let's fast forward to the present day, where we dealt with the COVID-19 pandemic. It is the most significant global health crisis in a century, and it affected every aspect of our lives. The mortality rates, economic and social disruptions, and the strain on healthcare systems have been enormous. And COVID-19 also helps us realize how underprepared we were for such a pandemic. And however, COVID-19 also accelerated advances in medical science, particularly in vaccine development, and has underscored the importance of robust public health infrastructure and global cooperation. Now that we've journeyed through history a little bit, let's dive into how we've responded to these pandemics. Our public health strategies have evolved significantly over time. Now, let's start with infectious disease surveillance. Infectious disease surveillance is the backbone of public health responses. Organizations like World Health Organization, WHO, The Centers for Disease Control and Prevention, CDC, and local health departments play crucial roles in tracking and reporting outbreaks. Through advanced methods like genetic sequencing and data analytics, we can now detect outbreaks faster and respond to them more effectively. Real-time data sharing and transparency are essential for early detection and rapid response. Now let's move on to containment and mitigation strategies. These strategies are our first line of defense. Quarantine and isolation measures have been used since the Black Death and continue to be vital tools in being our defense against these diseases. Travel restrictions and lockdowns, although challenging, help slow the spread of infectious diseases significantly, which is exactly why we use this first line of defense so much. Now, contact tracing and testing are modern tools to help identify and isolate infected individuals quickly. These measures were crucial for controlling outbreaks, as we've seen during the COVID-19 pandemic. Now, vaccination campaigns are also perhaps the most powerful tool in our arsenal. The development and distribution of vaccines has saved countless lives. However, achieving herd immunity can be challenging, especially with vaccine hesitancy and logistical issues. Now, during the COVID-19 pandemic, we witnessed the rapid development of vaccines through unprecedented global cooperation. Despite these challenges, these efforts have highlighted the importance of vaccines in controlling pandemics. And lastly, public communication is a very critical aspect of fighting infectious diseases. The importance of clear and accurate information cannot be overstated, because during the pandemic, misinformation can spread just as quickly as the virus, leading to panic and poor decision making. Combating misinformation requires coordinated efforts from governments, health organizations, and the media. Ensuring that the public has access to reliable information helps maintain trust and compliance with public health measures. Now, as we look back on the history of pandemics and the strategies we've used, what key lessons can we take forward to better prepare for future outbreaks? That's exactly what we're going to discuss in the next segment. Now, one of the most crucial lessons is the importance of early detection and rapid response. The faster we can identify and contain an outbreak, the less impact it will have. This requires robust surveillance systems and ability to mobilize resources quickly. Global cooperation and information sharing are also vital. Pandemics don't respect borders, so international collaboration is essential for effective responses. And building resilient healthcare systems is also another key takeaway. Strengthening healthcare infrastructure ensures that we have the capacity to handle surges in patient numbers during a pandemic. This includes having adequate supply chain and resources, such as personal protective equipment, ventilators, and medications. Now, investing in healthcare workers is equally important. Continuous education and training help prepare healthcare professionals for the unique challenges of a pandemic. Now, looking ahead at developing and maintaining pandemic preparedness plans is crucial. These plans should be regularly updated and tested through simulations and drills. Investing in research and development for emerging diseases is also essential. This includes studying zoonotic diseases, those that jump from animals to humans, and developing new vaccines and treatments. Finally, fostering a culture of continuous learning and adaptation ensures that we're always improving our responses based on past experiences and knowledge. Now, we've covered a lot today, from the history of pandemics to the strategies we've used and the lessons we've learned. Understanding the past and the present of pandemics helps us prepare better for the future, which is all we can hope for. Now, as we continue to face new challenges, the importance of robust public health systems and global cooperation becomes even clearer. Now, thank you all for joining me in this journey through pandemics and public health. I hope you've enjoyed this deep dive and found it both informative and engaging. If you've liked what you heard, be sure to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps me bring you even better content. Stay safe, stay informed, and until next time, this is Rutu Ruparel, signing off.